Can you get rid of herpes?
I must say I'm loving these dolly covers. Aren't they great?
I just feel
How
like we
did
need
you
to
find them
take
all? They're
action.
great. um, okay, so herpes, and what we're referring to there is the herpes simplex virus. There are lots of different herpes viruses. So herpes simplex virus, type 1 and type 2 are the ones responsible for causing genital herpes. Many of you may know that type 1 herpes was the one that commonly causes cold sores in the mouth that young children get. It's very common. A lot of adults are sort of immune to it. They've been exposed to it over their earlier lives. And type 2 more typically was responsible for the genital herpes lesions. In fact, now it's thought that type 1 is actually just slightly more commonly, the cause of genital herpes. So in other words, type 1 and type 2 both cause genital herpes. Now, the virus itself is not curable. There is no medication or drug yet that's been able to eradicate the virus from the body. Whether you've got an acute episode or if you've had it in the past, we know that the virus is able to survive for years, if not decades. The top of the nerve cells near the spine, and that's why people get recurrences. So for various reasons, it gets reactivated and you can get another recurrence of herpes. The sort of full-blown genital herpes infection is often a little bit of tingling or numbness or altered sensation in the skin near the genital area, and then followed maybe in a day or two by a very painful ulcer, and then maybe a day or two after that, it just heals over with no scarring. So that's a kind of typical herpes episode. There are now, and there have been for a long time, antiviral drugs which do help if there's a really, often in the first attack or the first primary infection of genital herpes, if antiviral therapy is started soon enough, it will shorten the duration of that primary episode. And these same antiviral drugs can also be used in the case of frequent recurrent episodes of herpes. They tend to shorten the duration and the severity of the symptoms. And they can also be used for what's called suppressive therapy. So if people do get frequent recurrent episodes of genital herpes, they can go on to suppressive therapy, which seems to actually suppress the recurrences. So been around for a long time, safe, have a chat to GP, sexual health service, and their prescription medications. So that you can certainly improve your quality of life, I suppose, by suppressing recurrent episodes or shortening them when you get them. But herpes is not curable, doesn't go away. And, it has a huge psychological impact on people who get episodes of herpes. I think there's possibly quite a lot of more stigma sometimes attached to herpes as an STI than some of the others.
You took the words perfectly out of my mouth, Mel. I remember when I was a sexual health counsellor that herpes was certainly the one that had the most psychosocial impacts, particularly on young people. If they'd contracted herpes as a young person, how do I sort of negotiate or navigate that in a relationship moving forward? And just to, I guess, touch on the reasons why we might be seeing HSV type 1 more in the genital area. Are you able to elaborate on that for us?
Yeah.
What's the practice that's leading to that?
Yeah, no, that's really important and something that, we need to inform young people about when we're doing any, giving them sort of general information and education around STIs. So it can it's transmitted through oral sex, and that's the reason why it's now thought that possibly type 1 causes of genital herpes has become more common than type 2. And it seemed to be a trend that started towards the end of the 1990s, where we started to see more type 1 genital herpes from oral sex. And there could be a whole lot of reasons behind that, but one of the things that I know several of my colleagues felt was possibly contributing to it was a kind of flow on from the HIV pandemic of the 80s and early 90s, and lots and lots of messages about safe sex and the possibility that more young people were seeing oral sex as a safer form of sex in terms of protection against HIV. I also believe actually that it's simply that oral sex, which has always been a practice in humanity, just became perhaps less taboo, and something that young people felt more comfortable engaging in. And that's something when we look at sexual behaviour studies of young people, so those adolescent years when young people are first engaging in partnered sexual behaviour. It used to be, and perhaps in my generation and older than me, that oral sex was not something that young people engaged in first. They might have had intercourse first, and oral sex was something that came a bit later. It was seen as a little bit more intimate. That's completely reversed now, completely and utterly reversed. So I think that's just been part of a trend amongst young people and what they're comfortable with in terms of sexual activity.
I agree, but I think it highlights the importance for us to still be talking about protection when it comes to oral sex. And indeed, it's one of the reasons why flavoured condoms were developed, because
that's right.
Is usually the only sexual orifice that has
that's right.
blood. So yeah, great response. Thanks for that one.